next Morning Line beginning at 8 on News Channel 5 Plus. From the News Channel 5 Network, this is Morning Line.
Good morning, everyone. Thanks for joining us on Morning Line. This is live. I'm Nick Beres. It's 8 o'clock on a Wednesday, and we have a good show on tap for you. We're going to open up the phone lines, and it's a health-related show. The last few days, we've certainly done a number of serious topics, including, the very latest out of Ferguson, Missouri, and what's happening on all that. We're shifting gears a bit today and doing one of our health-related programs, and we're talking about your dental care teeth with one of our semi-regular guests who comes on to answer your questions, your chance to get some questions answered with regard to dental care, teeth whitening, if you need a filling, you got a toothache. It's interesting, there was someone down in the newsroom the other day saying, yep, got to get to the dentist. Haven't been there in years and my teeth are hurting. I'm like, you know what? That's why they're hurting. You have to go more than just once every 5 years, I think. Anyway, the number, 737-7587 is the number. And with us this morning to confirm my suspicion that you should go to the dentist more than once every 5 years is Brandon Sims. Dr. Sims, good morning.
Good morning.
Nice to have you on.
Thanks for having me.
All right. How often should you go to the dentist?
It depends on your dental condition, but more than once every 5 years.
More than one?
Yes.
And it does. I mean, it's amazing. There are some people out there that, I'm telling you, they don't floss the way they should. They eat plenty of sweets. They don't brush the way they should. And they don't, now, their teeth may be kind of mucky looking, but they don't get cavities.
Yeah.
And then I'm someone who I don't know, whatever reason, I do a pretty good job with my dental care, and I've reduced the amount of sugars I eat, but before I did that, I was getting cavities left and right. I've got a mouth full of cavities, fillings now, of course. Why is that? Is it just genetics?
That plays a huge part in it. Genetics and just the type of bacteria you have in your mouth.
And that varies from person to person?
It does, yeah.
Is there any way to alter that? I mean, is that part of dentistry these days where, they can look and say, okay, you've got a certain type of bacteria that helps break down the protective coating on your teeth. Let's do something to treat that? Antibiotics or something?
That's in the works, I think.
Really? I was wondering, is that, how so? Talk about that.
So there's now genetic tests that you can have done. So we can take swabs of your gum tissue, or we can take a saliva sample.
Yeah, saliva, yeah.
And they can run tests to see what types of bacteria that you have, and then we can try to tailor our therapies towards that type of bacteria. Which
could be, would it be a, and I say antibiotics, and antibiotics kill bacteria, and they can be very specific. Would that be a pill? I mean, I'm just wondering, hypothetically. I know you're not prescribing this yet, and this is on the frontier, but would it be a mouthwash, you think? Would it be, you'd have to take a pill like you would take an antibiotic to treat a strep throat? What would you do?
Well, currently there are some therapies in place for gum disease that include systemic antibiotics, so things you would take as a pill.
Yeah.
But it's still not really widely accepted at this point.
Yeah.
But it's coming. I think it's coming.
Well, you know about the bacteria, because we've talked about this on the show before. When some people go in for dental work that's going to create some bleeding around the gums, if you have a certain condition, there's concern that certain bacteria can make their way to the heart or something, and so you give certain patients an antibiotic, right, for that reason?
That's true. We used to be really concerned about people who had prolapse or certain types of heart conditions. The American Heart Association has relaxed a lot of those protocols. Actually, back in 2006 and 2007, a lot of those were relaxed.
Okay.
The orthopedic surgeons are still real concerned about their artificial joints. So a lot of times they will recommend that those patients have a antibiotic before dental work for their lifetime.
Yeah.
The jury's really still out. There's not a lot of research that shows either way. So I think the truth right now truly is that the industry really has not come to a consensus, so we do it to be safe.
It's so crazy. I mean, that you think there can be a connection there, but yeah, people take it safe. And well, listen, the number 737-7587. If you want to jump in, as I said, we're shifting gears this week to this. So if you have a question, and I'm wondering, when you have patients come in and you have a thriving practice, what are some of the most common questions? I'm just thinking, I mean, so much of it's common sense when it comes to dental care, but do you get any unusual questions, or what type of things do people want to know most about their teeth?
I think the biggest thing that I see is, why do I need this? Because my teeth don't hurt.
Okay.
So that's a big issue. And I think it's important for people to know that when your teeth start hurting, it's a late sign in dentistry. So if you have a toothache, you already need a root canal. So that's why we talk about it's important to get in as a preventative basis so that we can do fillings, we can do crowns, we can do onlays and not have to do root canals or take out
And that's
teeth.
the trick, isn't it? I go to a dentist that looks and they monitor, and as I said, I've had fillings going way back. I had a mouthful of cavities, and some of them in the old days were the metal fillings, and so they degrade over time, and at my age now some of them need to be replaced. Now my tooth is not hurting yet. And it's maybe degrading a bit, and they're like, well, we need to replace this crown, this crown, this crown, and here's a news flash. Crowns aren't cheap. Now, I've got dental insurance, but still, that doesn't cover it all. And I'm like, oh gosh, but my tooth feels fine, I chew fine. Wait till you get a root canal, and then you understand, because you're right. You get the ache, oh, they don't just go replace the filling and that ache goes away. No, it's too late. Your tooth is infected, and you're done.
Yeah.
Root canal, expensive, painful, and a whole day in the canner because you got to sit there in the dentist chair and then recover later because you're kind of, sore with the jaw.
Well, it's important to know that once your teeth start hurting, that the only things that typically make that better are taking out the tooth or doing a root canal. And I think replace is a word that can be misconstrued, and I would say most dentists won't. We don't want to just replace a crown, but there's a cavity there that we need to fix, and the only way we can fix that cavity is by taking the old crown off, getting the cavity out, and putting a new crown on.
So so what you're doing is you'll discover a cavity that's maybe formed around, say, one of my fillings that's happened, an older one. You could tell the edges over time had worn, and there were gaps, and bacteria got in there, and through the x-ray or something, they saw there was a small cavity that hadn't started hurting yet, but it's there. Like, Nick, we're going to take out that filling, we're going to fix that little cavity, and then we're going to give you a new, nice, clean one. Now, I've had some done too where clearly either cracks have formed and a cavity hasn't there. But as a preventative, they're like, look, you can pay me now, you can pay me later. And I'd say, well, go ahead. If it's that messed up, take it out and give me a new clean one. You do that too, though, don't you? And that is a replacement.
Well, and the important thing is when we see a condition that we know is going to get worse, then the best thing we can do is stop it right then. We're only born with so much tooth structure. And we want that to, there's nothing in our lives that we use as much that we expect to last as long. So if you get all your teeth by the time you're 13, 14, and you want to have teeth when you're 90, what else do you have in your life that you expect to last 77 years, that you use 3 times a day, that you don't have to maintain?
Right.
So it's when you start thinking about it that way, it's really amazing.
It really is a good way to look at it.
How well our teeth hold up. I mean, it's amazing how well our teeth hold up.
Especially with some of us not doing the proper care that we should. No, you're right. My teeth, I don't know if I'll have teeth when I'm 90, and I hope I live that long, but part of my problem, and we'll talk about this more later in the show, is the grinding issue and things like this, that people have sometimes and how to treat that. But before we take our first break, we got a phone call, and like I said, we'll take calls. Call. Ask him. I've got all kinds of questions for the dentist. But let's go to William. William, before our break, we can get your question in. Go ahead, my friend.
Okay, I'm 59 years old.
59?
59, and I had a very bad car accident in 87, broke my neck in 8 places, ribs, nose, cheekbone, and had on my seatbelt. But since I went back to work as a barber stylist, I had to quit in 95 because the doctor said it was going to kill me. My spinal cord was going to snap and hit the end of feathers.
Yeah.
I had to take pain medication. And anyway, my teeth, I had good teeth and pretty teeth, and they're breaking off in front. I've not noticed any cavities, but there's just the two main front teeth are broke. They're breaking off.
Are you saying because of the pain medicine?
I would assume that would be it. I don't know.
So your teeth, your front 2 teeth anyway, became more brittle, is what you think? And you think it might be because of some of the treatments you're taking for some of your other conditions?
Is
that your question, kind of?
Yes. The medication I'm taking, could that be causing it? It's a painkiller called generic for Percocet. It's called Endocet.
Mm-hmm.
And I had to take 2 or 3 other medications, overactive bladder now, and plus I'm getting older.
Sure. Well, let's ask the dentist about that. Are there medicines, medications, things like this, and maybe there's foods too, of course, we can touch on, that make your teeth more likely to be brittle and maybe crack when before they were okay?
So if we look at the side effects of medicine, you know, every medicine you get has a big long list of side effects on it, right?
Pass on pills unless you have no choice, man.
Well, usually the first or second one is like headache and dry mouth.
Yeah, okay.
So especially when we start compounding, we get a lot of medicines on top of each other. The biggest thing that we see is dry mouth. Now, to speak to the question, dry mouth would actually cause you to typically have more cavities. So our saliva has a lot of good things that it does for us, but one of the things it does is it just clears out the bacteria. So we swallow saliva every couple of minutes, and it's pulling the bacteria down our throat, and we're getting rid of it.
So it's not sitting there, you know, just soaking into your teeth.
Exactly.
Bacteria. Yeah.
So if you don't have that salivary flow, then the bacteria just sit on your teeth.
Some pain pills, I bet, can give you dry mouth.
They can. Yeah, that's one of the big side effects of some pain medicines.
All right.
So that's a big deal. But if you're not noticing that there's more cavities and it's just breaking, then it's probably how your teeth fit together. And a lot of our bites just tend to wear down our teeth because they're not fitting together properly.
Are there solutions? All right, for instance, the dry mouth thing. Okay, you're taking a pain pill, hopefully for the reason you're in excruciating pain and you need it. So you're not going to stop at least until that condition improves. What do you do for dry mouth? Is that something where you should, is there a rinse, a gargle, or something like that you can do to maintain moisture in your mouth?
So the problem with dry mouth, whether it's a condition that you have or whether it's medicines that you're taking, is there's not a lot we can do to improve the condition. There are some other medicines that can help stimulate salivary flow, but there's not a lot we can do to improve that condition. So what we have to do is learn to manage it. And a lot of that is keeping in mind that everything that you eat feeds those bacteria and helps them grow and multiply. So drinking a lot of water helps, and then watching your diet. So not snacking in between meals, watching the things that you're eating at mealtime, and eliminating some of the things that are carbohydrate based and leaning towards more things that are protein based. Will really help keep those bacteria levels down. And then in between meals, lots of water, sugar-free gum, things that will help.
Maybe sugar-free lozenges of some type or anything like that?
Yeah. Anything that doesn't have sugar in it that can help stimulate salivary flow. But typically, folks that are on that have dry mouth due to medicines, the stimulated flow is not as affected as the baseline flow. So meaning that if we're just all sitting here, we've got a normal amount of flow coming through. And when we start eating, then the salivary glands really start pumping out.
Right.
And that stimulated flow isn't affected as much as the baseline flow, is what it seems to me.
Sometimes I work out, and I don't want to pound a bunch of water when I'm sweating, even though I don't get dehydrated. I use quench gum. Have you ever tried quench gum?
No.
It's this gum. It's basically got it's sour gum. You pop it in your mouth, and well, all of a sudden your taste buds and you start flowing with saliva for a bit. I don't know if that would help him, but whatever the case, it probably is a side effect from the pain meds to some degree. So there's a few suggestions for you. Look, we'll take a break. When we come back, if you're on hold, stay there. Rose, we'll get to you next, and we've got some other lines filling up, but we have some open. 737-7587. Questions for the dentist, thinking about whitening your teeth, thinking about some of the treatments in pain management for folks who, it's amazing, are so fearful of the dentists. You probably run into a few of those, and you have ways of making it more comfortable for them. We'll get into all that and take more of your calls right after this. Stay with us.